And here we go. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott. This is Brad Greenberg.
Dr. Greenberg, always a pleasure to have you on the program. Thank you. Megan is here as well.
Hey.
And so
Good morning.
Morning.
we were just talking about the weekly COVID-19 cases, the 7-day rolling average, Dr. Greenberg, which the state puts on their website, as I'm sure you are aware and have seen, and that the case numbers have increased dramatically, at least in the last couple of weeks, to now about an average of 300 cases a day. We are hoping you can confirm that hopefully not all those folks are finding their way or needing to go to the hospital. Are hospitalizations holding steady or maybe down a little bit, or are you guys still pretty full?
Well, these are great questions, and they're actually we're living through this new Omicron wave, which really is different than previous ones. I mean, and this is it's been very interesting because what we're seeing is an astronomical increase in percent positivity and cases. Now, the question really is, just like you're saying, is does this translate to inpatient admissions? And usually in past waves, what we've noticed is in the community, there'll be an increase in the percent positivity. There'll be an increase in emergency department visits, increase in the number of folks that actually present complaining of influenza-like illness or COVID-like illness. And then that's followed by hospitalizations, which then subsequently leads to intensive care unit utilization and ventilator days. So where we are right now is in the last week or so, we've noticed an increase in our inpatient census, which is kind of creeping up day by day. We've gone up by about 15 cases, and currently what we have in the hospital is we have 46 folks that are COVID positive and 2 persons under investigation for a total of 48. And so this is creeping up. It's not where we were during our previous Delta surge, and we're all keeping our fingers crossed that the community and the burden for the hospital and healthcare infrastructure remains moderate. But across the country, it is somewhat stunning, though, because the Omicron surge, even though it has been like many of the folks and the proportion of those folks that require hospitalization is less, the number of folks hospitalized simultaneously is well over 155,000. And that's increased markedly, over 60% in the last couple of weeks, surpassing last winter's peak by over 20,000 folks. And so we're hoping that across the country that we've peaked, but it is still not clear, and we're somewhat at the edge of our seats.
That makes sense. And so, I mean, I think it's fair to say that there's a ton of COVID burnout, and there has been for a while, but that there's this understanding that maybe Omicron is not as severe in its effects on people. It also seems to be impacting people who are vaccinated. I mean, what is your advice? I think there's a lot of people saying like, well, whatever, if I get Omicron, I get Omicron. Let's just move on with life and get back out there and do life as normal. I mean, what would you say to those folks?
Well, I think that, our perspective looking at what's happening throughout the community is always a little bit different. I mean, we're thinking about this as our community hospital really looking out for the best interests of the health and well-being of the community. So we look at this through what could we do to do better, to keep people healthy, to keep people out of the hospital. And despite the fact that the proportion of folks that get Omicron that require hospitalization is less, there are so many folks that are simultaneously ill that it's still having an impact at the hospital. And so to those folks that are tired, I think we're all tired. We're all tired. But I think that this pandemic comes in waves. And there are times where we need to pay more attention to COVID-safe practices than others in the context of the last couple of years. And right now, despite the fact that we're fatigued and despite the fact that it's challenging, right now is one of those times where we need to be a little bit more vigilant. I do think that those folks that have been vaccinated and boosted, they have considerably reduced their risk of severe COVID. So that's hospitalization and death. But those folks that have not been vaccinated, I believe that they are considerably at risk. And these severe cases are largely among the unvaccinated. Now, we continue with the Omicron surge to have a whole lot of people die every day within the United States. And, we're looking at, let me find that number here for you. It's over 1,900 deaths per day. And that's the Omicron surge, which is supposed to be, people believe is not as severe. This is still a significant illness. And I would implore people to, dig deep and use those COVID-safe practices and get vaccinated. And hopefully we'll emerge on the other end, and Omicron will hopefully change the landscape. So hopefully we can finally get out of the pandemic.
Wouldn't that be great, Dr. Greenberg? And I wanted to ask you, too, there was another, I think, milestone in New Mexico announced this week that about 90% of the population that's eligible for a vaccine has at least gotten their first vaccine for COVID-19. Does that offer some encouragement to you and your colleagues in the healthcare system?
Well, absolutely. Anytime we're seeing vaccine adherence, we're seeing folks, really make good choices that are reflective of excellent science and research, which really has real-world, on-the-street implications for what happens with your neighbor, with your friends, with your family, and our ability to get out of the pandemic and emerge from this. So it's absolutely encouraging, and I would continue to implore anyone who's on the fence, get the facts from someone that you trust, get the facts from a physician, get the facts from, and make science-based decisions. These are safe, well-studied vaccines. They make a huge difference. They'd make a huge difference to you, to your neighbor, to your friends, to your family, and to our community. So please, let's get this vaccination, and let's try to look towards a brighter future.
Very good. And this is a question that harkens back to, now years ago, but we kept hearing things about herd immunity for a while there. The Wall Street Journal just produced an article that was comparing super immunity to herd immunity. Have you heard about this concept? Can you speak to that?
Well, the super immunity concept has been this idea that folks that have been vaccinated and then also get the infection, they've noticed, at least in laboratory settings with measurements of antibody titers and whatnot, that these folks may actually develop an immunity to, more generalized immunity to coronaviruses in general. Now, it's still kind of in the research phases. I mean, it's somewhat reassuring, especially when it comes to the development of vaccine science. But, the COVID-19 pandemic has just been unprecedented. And we've gone through these phases of what can we do to mitigate this? We go through containment and mitigation. We've gone through these ideas of herd immunity, vaccination proportions, and trying to figure out how to emerge from this on something in a society where collectively it kind of looks something normal, like what we remember from, way back when in 2018. So I think that we're not quite there as far as trying to hang our hats on quote unquote super immunity. I think that the idea with herd immunity is a little bit challenged also because the COVID-19 has been demonstrated to not just have one variation, but a series of variants that have now proven somewhat elusive for the vaccine, meaning we continue to have protection against severe COVID, hospitalization, and death, but folks that are vaccinated largely can actually get Omicron. So how we move forward and how we turn the COVID-19 pandemic from something that occupies a lot of space in the forefront of our minds to something that's there, but perhaps doesn't represent a daily concern, I think is a goal of everyone. But let's make sure that we land on our feet, that hospitals are still here to care for folks that have COVID or any other issues that are not COVID related. And hopefully we can get back to something that looks normal. I'm excited to see and follow the ongoing and developing science, both the immunologic perspective as well as the vaccine science. Hopefully as we can follow this as the Omicron wave recedes.
Very good. And I think all of us are optimistic as to maybe what science is learning from all of this and these vaccines and just how quickly they were developed with this technology, though it has been around for a number of years, decades, as a matter of fact. Dr. Greenberg, before we let you go today, I wanted to ask you a little bit different topic about flu season and if you're seeing many cases of flu at the hospital these days and how that's going, because this is normally the middle of flu season, if I'm not mistaken.
Absolutely true. And, as part of our COVID surveillance, we're following all the influenza cases as well as the cases of respiratory syncytial virus, or RSV. And so we are noticing cases of both flu and RSV, but they are not a large proportion. Our respiratory illnesses are still overwhelmingly COVID. So we're following them. I think we've only had maybe 1 or 2 inpatient admissions for influenza. And we do, of course, seasonally have children that are admitted for respiratory syncytial virus. But it has not been, it has not supplanted the COVID-19 burden when it comes to respiratory illness in the community.
Very good. Well, Dr. Greenberg, as always, thank you so much for joining us. It's always helpful to get your expertise and the swarm of information that's always swirling around out there. We just appreciate you coming on.
Well, thank you so much for having me, and please, everyone out there, stay safe, get vaccinated, and continue with those COVID-safe practices, and we're going to emerge on